Hi, I'm Dr. Nick. I'm the incrementalist here with incremental insights for a better business and better health.
And I'm Fred Goldstein with Accountable Health, and we're helping companies reopen during the COVID pandemic.
So, Fred, can we reopen safely?
It's really an interesting question, and we're seeing all kinds of things happen right now as the colleges begin to reopen. And
Right.
obviously, some of them have been showing some outbreaks once reopening. And that's to be expected. If you think about it, you're testing people in advance, trying to, as we say between you, myself, and Luis, as we work together on these projects, shrink the funnel a little bit. What's coming into the school, if you can identify those who have COVID or asymptomatic and have COVID and keep them from coming to campus, obviously you've reduced that risk of an infection. But you've still got individuals that are going to become infected or go out and do things and activities, and they too become infected. And we're seeing that now at North Carolina and some other universities as they reopen. Probably not as successful as they had hoped, but that's something to be expected. The question really is, how do you execute against that and run appropriate contact tracing? Isn't that really what it's about, Nick?
Yeah, so it brings up a number of issues. So it's, the testing, tracing, and ultimately treatment, which, in this particular context, we're not thinking about. But the testing and tracing is really a sort of fundamental component of any strategy going forward. And I think the point that you make for me is really important to understand. The idea that we're going to do any of this and find nothing is, of course, preposterous, certainly in this country. By the way, in other countries, in New Zealand, they're finding nothing if they're doing any surveillance testing. And I don't even know if they are, but, potentially that's, we might get to that if we could ever follow directions and, do the things that we're required to do. But from a testing standpoint, this brings up a major issue. So first of all, we have this huge problem of testing capacity and also turnaround time. We've seen this massive extension of turnaround time from the national labs, going from, several days to 5 to, wow, going up to even, I heard 10 and 14 days. And just by the way, that is a turnaround time, quite frankly, pointless, because at that point, you either developed the disease or didn't, so you got symptoms and then we have a whole process, or if you didn't and you were infected, you are no longer infective, because we know that from a time-based strategy. So the turnaround time is an imperative in this. So what do you do in the intervening time? So you're going to go testing these individuals. What do you do with them at the intervening time? Well, do you isolate them? And if you're doing so, what kind of percentage of folks? So it brings up all of these challenges that people have to think about. And my view of this is you have to be an expert contact tracer to be able to manage and coordinate this. And that's not something that these places or businesses are really expert about.
Yeah, it's interesting because there was also an article that came out about UC Berkeley. And during the summer, they had an outbreak associated with some fraternities in their Greek life. And they talked about that, and the head of the health services department, the physician at UC Berkeley, quickly identified that there was this outbreak going on, immediately started calling contact tracing within 3 to 4 hours of positive testing, and went ahead and began to isolate these individuals off, explain to the fraternities what they needed to do, those who were in off-campus housing or other housing, what they needed to do, and brought up some interesting issues to think about. In many cases with students, they may not want to tell you who they've been with. And so that makes contact tracing a little more difficult. But obviously, if you can notify that student to then say, hey, notify these other people, understand you may not want to discuss all this with me, and make sure that they understand where they're at and what they need to do. And they were able to tamp down this outbreak. And I think that's going to be the key. We're seeing blips all over the place. The question is, do you execute against it? And can you quickly, and as you say, rapidly do that to tamp down that outbreak?
So it brings up a lot of memories for me, because when I was training, one of the things that we had in our hospital was an STD clinic. We were actually in the nexus of some really big challenging problems around HIV that was untreatable. And that was exactly what was going on then. So this isn't a new problem. It's part of contact tracing. And one of the things that I want to draw out of what you said that is absolutely essential in this is that contact tracing is not something you go, all right, I'll put that on the pile and we'll do that tomorrow. No, you do it immediately. And in fact, I saw a really interesting piece that talked about China and the way that they approach contact tracing in their region. And essentially, if it wasn't completed, so not just started, but completed within an 8-hour period, they were issuing sanctions against the individuals that were doing the contact tracing. Now, there was a little bit more of an oversight that I think socially compelled people, because this was part of the principle of, I want things to get better. And, there are methods around this. In the days of STDs, it was paper-based, and we would hand somebody a paper-based note that said, here, this is the disease, you get it to the people. So, trying to make it as anonymous as possible. And I respect that need for privacy, but if we don't get this right, it doesn't matter how brilliant our testing strategy is. If we're not tracing and then following up and isolating and doing all of the quarantine that's necessary and additional testing, we're not going to knock this on the head. We're just going to keep on going through this cycle, and everybody's going to go, well, my privacy's okay, but we're still living in this bizarro matrix world. And I want to get out of the matrix. How about you?
Yeah, I agree with you completely. It's time, as we look at this, there's a risk. There are varying levels of risk. We know how to reduce some of those risks. We can't take it to zero, but we can reduce the risks and begin to safely reopen certain things. And it is going to be about a comprehensive system, as we've discussed with many people, of testing, tracing, quarantine, isolation, and daily screenings. And you brought up the issue of these rapid tests, and hopefully as those come out, we can begin to implement those, which will make this a little more timely and easier to function that way.
Absolutely. So I think, important things for businesses to think about is that contact tracing, even though it's a public health issue and your governments and local policy providers have that, you need to have some incorporation of that whilst respecting privacy and finding pathways through. And as a group, as a society, we all have to sort of see this together. And importantly, not be pejorative. Somebody has COVID-19, let's not treat it as this sort of pariah, what a terrible thing, and focus on the no fault. For me, this is just like root cause analysis when we look at errors. It's no different. Find the positive in this, allow us to get to this, and we can return to the normality that they have in New Zealand. I keep citing them, but they're just going about behavior as if there's nothing going on. That's the world I want to live in.
I agree completely. And once again, another fantastic week, Nick. This is Fred Goldstein with Accountable Health.
And this is Nick Van ter Hayden. I'm the Incrementalist here with Incremental Insights, better business, better health.